to our top story tonight. President Biden taking aggressive new steps to move forward on mandating COVID vaccines as the Delta variant devastates areas with low vaccination rates. 1,500 people are dying a day. And one of the hardest hit states right now is Kentucky, where hospitalizations are up 867% in the past 2 months. Our Miguel Marquez is out front in Kentucky.
It's more cold, believe that.
Billy Couch didn't think much about COVID till he got it.
Don't mess around, because this ain't a joke. This is not fun and games. I've been here so long, I want to go home. But I can't go home because I can't breathe still yet. This is not a game at all. When you're sitting there and you can't breathe, you feel like you're going to die.
In the hospital, 19 days now, the unvaccinated 42-year-old isn't sure how he picked up the virus. He toughed it out at home for 8 days before being admitted.
How serious is COVID?
It's bad to the bone. I recommend everybody wash their hands, do what they got to do. Stay home, stay social distance, because it's bad. Trust me, it's bad.
Until you had it, did you think it was bad?
No.
Why'd you think it was?
I didn't pay no attention, to be honest. But I do now. And get your shots.
Wanda Combs manages the nursing staff in the COVID ICU at Appalachian Regional Healthcare's largest facility in Hazard, Kentucky. A nurse for 30 years, the job never tougher.
It's been very, very hard. And I get emotional because it is our community. ICU nurses work really hard. They work very hard every day. But you can usually see a difference. So you work hard and you see a difference, and that's okay. You don't care that you're tired. You've made a difference. So with this, they still work just as hard, harder, and it really hurts when you don't see a difference.
Just when they thought they were through the worst of the pandemic, it's come roaring back. Patients younger, sicker, harder to treat.
The family, it's hard for them to realize, oh, you mean this is the end? Do you really mean this is the end? It is our community. It's people that we know people that are related to. So that's what's really hard on the nurses is the emotional part too.
In the COVID ICU here in Hazard, every bed taken by those suffering from severe cases of COVID-19. Every patient intubated except for one.
What is this virus doing to places like Hazard, Kentucky?
It's destroying us. Everybody's getting it. Everybody's getting sick. I don't know. We're just seeing a lot right now.
Appalachian Regional Healthcare has 13 facilities across eastern Kentucky and West Virginia. Its entire system now overwhelmed by COVID.
We have no ICU beds available, zero. Across 13 facilities, we have 0 ICU beds available. We have 35 patients waiting in our ERs for beds.
Today, Appalachian Regional Healthcare has three regular beds available across its entire system. They've cleared space and made room for 200 beds that sit empty, unable to staff them.
We have applied for FEMA disaster medical teams at multiple of our hospitals. Our understanding is right now that Louisiana is in dire need, and so most of their teams are there. So we are on the list, and once they have availability, we hope that we will be able to get support.
The hospital system needs 170 nurses today to open up extra beds. Nurses now working longer hours and doubling up on patients just to keep up.
One respiratory therapist should comfortably have 4 ventilator patients, because we work with the nurses as well. But right now I have about 7 to 8 ventilators per respiratory therapist.
Here in Hazard, patients are coming in younger and sicker than nurses have ever seen.
We're seeing much younger patients now than we did before. So we're seeing I have patients from 20 years old today up to 75 years old. So it attacks everyone. It's not just limited to one age group.
This year, it doesn't matter. I've had several patients under 20 years old.
How sick?
Very sick, actually, for their age.
Miguel joins me now from Kentucky. Miguel, it's hard to watch that. I'm just thinking about the man you were talking to at the beginning in the hospital bed. You've been in so many hospitals, and he was saying he doesn't know how he got COVID. How are these individuals getting COVID in many of these situations? Do you know?
Yeah, in most cases, it is from trusted family members. He's not sure because there were so many people around him that had COVID, but in many, many cases, it's somebody that they trust, that they know, a family member who comes into a household and then infects everyone, or it's a funeral, or it's a wedding. Sporting events as well is starting to be a major factor in spreading COVID here. You know, this is Perry County, and it has it's a small county, rural place. Nobody thought they'd get it here. It has today, right now, has one of the highest rates of infection in the entire country. Aaron?
Miguel, thank you very much. And thanks to all of you for being